Greetings and welcome, colleagues and friends around the world. In terms of traditional Zoom greetings, good morning, good evening, good afternoon, and good afternoon and good evening, friends. I know we have colleagues from various parts of the world. Particularly, I had a note from colleagues in West Africa, University of Ibadan, who are participating as a group. And also there are some colleagues in the Americas who've sent good wishes for this particular meeting. And the European Police Federation has been particularly interested in this particular webinars because law considers a diversity of issues. And it's good at this launch session for the UFA webinar that there's been a diversity of colleagues who have expressed interest in this particular webinar. As you know, this particular webinar is part of the European Public Health Week, and the theme of this particular week is around joining forces for healthier populations. And this webinar has joined forces because it's been organized by the UFA Law and Public Health section in collaboration with the UK Faculty of Public Health, the Ethics section, and a number of other colleagues. And indeed, each day of the European Public Health Week has a particular theme, and the theme for today is All for One Health. And the theme for tomorrow is Leaving No One Behind, which are fundamental issues for law and particularly public health law. I think, as colleagues know, during the COVID outbreak, the importance of law has been increasingly recognized. And that is in fact why the European Public Health Association has decided to form this new section on law and public health with its new president, Professor Amandine Gard, who you will meet in a minute. There has been a tendency for lawyers and ethicists largely to talk among themselves, at times in Greek or Latin, and with practitioners also to just get on and not take enough notice of law. There's a fundamental importance of forming strategic partnerships for ethical legal experts to work with public health colleagues and policymakers to improve and protect public health. And this is very much the conversation for today about the importance of law to the public health agenda, but not talking in Latin or Greek, but talk in the language of better health for all. The other issue which I was asked to particularly highlight is to highlight the lack of research around law in public health interventions. And COVID has highlighted the centrality of its importance. But for example, in the US, less than 0.5% of the research budget has been spent on studying law. And we quite clearly know, and we'll discuss more in today's webinar, around the fundamental importance of law, as Annie calls it, in unleashing the power of law. So in today's webinar, we've got a distinguished team of scholars and a number of public health colleagues who will present. And we're delighted to have Professor Martin McKee to be a discussant, to assist us to reflect on the issue. With your agreement, we'll have the presentations first, and then we'll have a discussion and to answer some questions. And I'm sure everyone is a Zoom expert, and you can put your chats and questions in the Zoom, and then there'll be good opportunity at the end to have a discussion, answer any questions, and also to learn more about the section. So it's my great privilege to introduce you the first speaker, who will be very familiar to many of you, Professor Larry Gostin, who's Professor of Global Health Law and Director of the O'Neill Institute for National Health Law and the Collaborating Center for Public Health Law. He's sometimes referred to as a father of public health law, and many of his seminal works around public health law have become texts for scholars and influence policy greatly around the world. He is, as many of you know, aware of his many publications and recent book last year, a seminal book on human rights law and public health law. He actually has worked at policy level nationally. He was part of Hillary Clinton's health plan and part of the presidential task force on healthcare reform. And he's chaired lots of groups and meetings, including on legal determinants of health, leaving no one behind, which I think is very appropriate to Public Health Week, and also the mission of our newly formed European public health law and public health section. So with your privilege, I just want to now hand over to Professor Gost.
Hi, I'm Larry Gost, and I'm a professor of global health law at Georgetown University and director of the World Health Organization Collaborating Center on National and Global Health Law. I'm really pleased to be with my colleagues at the European Public Health Association. You do remarkable work for the public's health and the safety of the public in Europe and globally. So it's a deep privilege for me to be with you. I was asked to talk about the role of law and the legal determinants of health. And I had the privilege of co-chairing a Lancet commission on entitled The Legal Determinants of Health. Right now, we're going through a health crisis that none of us have ever gone through before. It's a once-in-a-lifetime experience. We hope that it'll never happen again in our lifetimes. The COVID pandemic has caused incalculable suffering, economic decline, social distress, loneliness. And it's not just that COVID has taken lives and hospitalized so many vulnerable people. The indirect effects of COVID-19 are just as remarkable. We've seen a surge in certain non-communicable diseases like cancer. And we've also seen enormous food insecurity. We've seen women's health devastated. We've seen people going into absolute poverty. And the Sustainable Development Goals of the United Nations, which were on track to do rather well, have all shattered. And even the most fundamental kinds of public health interventions globally, like childhood vaccinations, have fallen far behind. And this does show us that we're one world, we're one planet, and we're one health, where all of the risk factors for infectious diseases, non-communicable diseases, and injuries are intertwined. But we've also seen that law has played an enormous impact. Who could have imagined, for example, just a year or a year and a half ago, that we would close down cities? I know that when Wuhan was closed down, I gave my opinion that that could never happen in London, Paris, Rome, New York. But of course, that's exactly what happened. And it also happened in places like Delhi and India, with the largest lockdown in our history. No one has been unspared. And in fact, at the height of the pandemic, 60% of the world's population were in some form of lockdown. This all involves law. We order people to stay in their homes. We can isolate or quarantine them. We can require them to be tested. We can do contact tracing. We close businesses down. We shutter entire economies. And this is all requires law, but it also requires the rule of law, because we've also seen that many authoritarian rulers around the world have used this public health crisis as a subterfuge for violating people's human rights, with detentions, grabs for power. And even in so-called democracies, like the United States, Brazil, we've seen populist leaders, nationalist leaders that have not followed science. And the world is unraveled in many ways. Rather than thinking, well, we're all in this together, the opposite has happened. What we've seen is we've been pulled apart. And probably the most vivid example of that was at the beginning when we had free-for-all and a competition for personal protective equipment, ventilators. And now we have vaccine nationalism, where the UK, European Union, the United States, and other countries have literally hoarded vaccines. So we're on track to get a good handle on this pandemic by the end of this year. But it's at the current rate we're going, the rest of the world is not going to be fully vaccinated or even substantially vaccinated for many years. The inequities are just stunning. Inequities both within countries, for example, in the United States, African Americans have suffered from COVID 4 times more than white populations. And this is played out everywhere else. But globally, the difference between rich and poor countries couldn't be more stunning. And as we talk, President Biden has already thrown his support toward an intellectual property waiver at the WTO for COVID vaccines. But it's far from certain that we're going to have a big, bold global plan to equitably vaccinate the world. And so I want to talk a little bit about the legal determinants of health. And I've often thought that there are multiple legal levers to enable us to improve the public's health and safety. I would start with the informational environment. That is, things like warnings on packets of cigarettes, particularly graphic images that we see. We also see warnings on package labels and for drugs and alcohol. And we see health education campaigns in many parts of the world with COVID-19. These campaigns have been abysmal, and we're seeing large populations that are refusing to mask up, to socially distance, and even large numbers of our populations across the world not wanting to be vaccinated. And a lot of this has to do with conspiracy theories and other aspects on social media that misinform the public. And so health education, warnings, instructions, all of these things are part of the informational environment that are critically important. But even with good information, it's possible that we still can't get cooperative behavior. And so, take the fact, put yourself in the fact, in the circumstance of, say, a mother. And the mother is informed, well, you have to give your child a healthy diet. You have to send your child out to play for physical activity. But if the built environment, which is the second lever from the law, is inconducive to those things, the mother can't do anything. So if there are no supermarkets nearby that are with affordable fruits and vegetables, or if there's gun violence or other violence outside and she can't send her kids out to play, or if there aren't green spaces and football pitches and baseball things, basketball places that are nice, nothing we can do. So our built environment is critically important. I've been around the world, and I know there are places that have wonderful environments for health and well-being, and others that have very little. You go to Sydney Harbor, for example, and you see the music and the sunshine and pedestrians and everyone is just kind of walking around and looking at each other and living. That's a good environment, but then there are many inner city environments, particularly in low and middle income countries, that are really, really hard to get good food, sanitize, to get good water, to get proper physical activity. The third lever, of course, is direct regulation, and I've put this third, even though most people think of legal regulation as direct regulation, things like contact tracing, quarantine, closure of businesses that present hazards. These are all direct regulation, and they have been an important part of public health for many decades and centuries. But they're only one part of public health, along with trying to make a better informational environment, a better built environment. We also have an economic and social environment, because we know that the deeper determinants of health, the upstream determinants of health, have much more to do with basic things like income, gender empowerment, and racial equality. We know that being a person of color who is poor is going to have lower health outcomes. And so improving the socioeconomic environment is crucial, as well as the physical environment, the regular environment, that is the natural environment, so they can breathe fresh air and we don't have to worry about our kids having exacerbated asthma and other breathing difficulties. And we also know that the economic and social and natural environments are prime targets for the spread of infectious diseases. So all of these are crucial. There's also the indirect ways that we regulate through the tort system. And the best example of that would be the tort system with tobacco, suing tobacco companies, suing alcohol companies, critically important ways of doing it. And finally, there's the economic environment in terms of taxing and spending. If you tax an unhealthy product like tobacco or alcohol, less people are going to use it. We've experimented with things like sugar taxes or soda taxes that really can help us improve the public's health. And all of this has to be embedded in the rule of law, as I've said before, because law is an extremely important thing, but we also need law to empower civil society. We need the rule of law to have freedom of expression and freedom of assembly. And we need people to have the power to petition their government for a healthier, safer life for themselves and their children. And I just want to end with what I regard as the most important narrative of our time, which is the narrative of inequity and injustice. Martin Luther King famously said that all inequalities are unjust, but the greatest inequality are health inequalities. And it's what your mother told you. Health is the most important thing that you've got. And if you got your health, you can do many other things, and you don't have to worry about them quite as much as if you've got health and safety. But what we've seen in the world are huge disparities, economic and social disparities and health disparities, with large swaths of the population being left behind. And this has been so amplified by the COVID-19 pandemic, where we see the difference between the rich and poor, racial minorities and racial majorities, between marginalized people and people in power, with huge separations in their life's circumstances. We say we're all in this together, but in some ways we're not, because many of us can stay home. We've got stocked cupboards. We can work remotely, but others are at the margins of life. They need to get to work. They need to focus on childcare. They need to have food and income for decent housing and for a good life for their family. And the COVID pandemic has been dreadful for those. So going forward, we need two things, and they're both important and interconnected. We need health, that is, better health outcomes for all of the world's people, for infectious diseases, non-communicable diseases, and injuries. All of these things are critically important, as is mental health, which is often ignored. And at the same time, we need these goods of human health to be equitably distributed, so that nobody feels that they've been left behind, that nobody feels that they have higher risks of disease and a shorter life than other people, no matter where you live, in a rich country or a poor country, or within a country, in a poor inner city area or in a rich suburb. You still have the same dreams and aspirations for a good life. And those dreams and aspirations for a good life are we call the right to health. And law can be a powerful tool in ensuring that everyone has the health and safety and well-being that we all deserve as human beings. Thank you very much for having me, and I wish you a very good conference. I wish I could be there with you. Take care.
Thank you very much indeed, Larry. As he hinted, actually, unfortunately, Larry cannot join us in the Q&A section because of the lifting of some of the travel restrictions. He's traveling to see his grandchild for the first time. Love conquers all. So obviously he would love to be here, but unfortunately he will not be in the Q&A section. But he's very much supporter of the proposed section, and we can continue the conversations the other side, and other members of the panel are able to answer the questions and so on. I think we had about 500 people who actually registered for this particular webinar, and we were quite interested in very quickly to get a profile of the attendees, if possible. So we just wanted to do a very quick basic poll. Public health people love sort of basic data. So in the next 10 or 15 seconds, we're just going to show a couple of questions, which would be very grateful if you could very quickly respond, if possible. So if Monica, you could put up the poll, if that's, yes, colleagues. So if you could please quickly put where you're from at the moment, and press the submit button, then she will put up the next question. Monica. And we weren't sure the best way to express this question, but you just get some sort of basic baselines about participants. And finally, I think there's another question which UFA colleagues were particularly interested in, and Monica, thank you. You can answer more than one, of course, in this particular section. So, thank you very much indeed, colleagues. In fact, UFA and ASFA did a survey of education and training some months ago around education and training in public health ethics and law. And there were certain findings which hopefully Amandine, as the president, will share in the future, which highlights the importance for us collaborating around legal literacy and advocacy work. So thank you very much for participating in this particular survey. It's my great pleasure now to introduce our next speaker, Professor Amandine Gard, who is the president, in fact, the founding president of the new UFA Law and Public Health section. Many of you will be aware of her work, particularly around EU trade and so on. She's professor of law at University of Liverpool, but she's also a qualified non-practicing, as she's noticed, solicitor. She was the founder of the Law at NCD Research Unit at Liverpool, which has become quite an influential unit in terms of advising WHO, NGOs, a number of other agencies, and she's written a number of policies. And I was particularly interested in her policy work around the child's right-based approach to food marketing, a guide for policymakers. So it's great to have her as a president because quite clearly she's linked to policymakers and practitioners. She's also the PI of the Petra Network, which we'll hear about in the future network. And I think with her permission, I just want to advertise her recent book on the Ending Childhood Obesity, a challenge at the crossover of international economic and human rights law, which she published in December, despite all the other stuff going on in the world at this particular time. But I think her most important issue is that she's the new president of the new section. It's my great pleasure to introduce you, Amandine. Thank you, Amandine. Over to you. You are on mute, Amandine.
You always need someone to be on mute. I was saying thank you very much, Farhang, for this generous introduction. And thank you to everyone for participating in this webinar. Can I check before I continue that you can see my, my slideshow?
You need to go on slideshow, please.
Okay. Right, so the question of the role of law has gained increasing importance in public health debates. And not only do the international commitments that states have made to reduce disease prevalence often call for regulatory interventions, but there is also a growing recognition that law as a discipline has a major role to play in framing effective public health strategies at local, national, regional, and global levels. And it is to respond to this evolution that UFA has established a new section on law and public health. You will hear from a few of us today, but the steering committee is much larger, and I would like to thank all the colleagues who have made the establishment of this section possible. As Larry Gostin has shown, the value of legal intervention and its inherent potential in stimulating progressive change are considerable. And law is indeed expected to help societies to respond to pressing global health challenges. Law has supported many public health successes, and it has the potential to support many more. However, if we want to maximize the opportunities that the law offers to promote better health for all, we must understand the constraints that the law may impose. And I should add at this stage that this presentation is not sponsored by Heineken. So the question is how industry actors, potentially very powerful industry actors, have used the law to oppose or delay the adoption and implementation of health promoting measures. In fact, we've noticed that the more effective these health promoting laws are likely to be, the more they are likely to be contested. I'll take an example because time is limited, and the example is the adoption of a mandatory front-of-pack nutrition labeling scheme. This example seems appropriate because it is exactly 1 year ago that the European Commission published its Farm to Fork strategy, where it announced its intention to propose a mandatory EU-wide front-of-pack nutrition scheme. Now, as we know from the many legal disputes that British American Tobacco and Philip Morris have mounted against the UK and Australia respectively for their tobacco plain packaging schemes, packaging is a highly contested territory. Therefore, when states or the EU as a community of states have attempted to regulate the packaging of harmful commodities, they have encountered vigorous opposition from industries manufacturing, distributing, or promoting these commodities. So, in 10 minutes, I cannot map all possible legal challenges that the adoption of front-of-pack nutrition labeling may raise if this adoption is indeed enshrined in law. But there are many, and this slide is intended to give you a flavor of what these challenges may be. Firstly, legal challenges are likely to be mounted in a variety of fora. National courts, regional courts, such as the Court of Justice of the European Union, international tribunals, dispute settlement bodies, such as the WTO, World Trade Organization dispute settlement body, international arbitration tribunals, etc. When Australia was faced with challenges against its tobacco plain packaging legislation, it had to defend the scheme before national courts, before arbitration tribunals, and before the WTO dispute settlement body up to the appellate body second instance. So these are extremely costly. But if these challenges fail and the legislation is indeed upheld, then we have significant victories for public health. Secondly, industry actors will challenge rules on a variety of legal grounds. There may be a variety of judicial review grounds, from constitutional challenges before national courts or regional courts. For example, when you restrict marketing or regulate packaging, very often we hear industry actors invoke their right to free commercial expression because advertising, we're told, is a source of information. There are also challenges based on the right to property, which includes the right to intellectual property, and therefore can be invoked when questions regarding the use of trademarks and the restrictions on trademarks is at stake. And you will have very frequently challenges grounded in international, regional, and international trade law, European Union market, internal market law, so European Union trade law, and international investment law too. Again, we don't want to speak Latin or Greek as Farang suggested, but nonetheless, the devil will lie in the detail. And if you look at Article 2 of the Technical Barriers to Trade Agreement, one of the WTO agreements, then you need to ensure that the measures you adopt to protect public health are not more trade restrictive than necessary to fulfill a legitimate objective. Now, it goes without saying that in 10 minutes, we can't discuss in depth the principle of necessity or the principle of legitimacy. But this slide alone shows that there is value in engaging with lawyers from the very beginning of the regulatory process that is going to lead to the development of health promoting measures, being tobacco plain packaging legislation, front of pack nutrition labeling, and so many other health promoting measures we can think of. A legitimate objective, we know public health protection is, we know that disguised protectionism is not. Again, there is an enormous amount of case law, WTO case law, European Union case law on this notion of what is non-discrimination and what goods are like or similar products, etc., etc. So these very legal concepts require legal analysis, and we need some partnerships between the health community and the legal community to really flesh them out and ensure that they apply well to they have been duly considered to in relation to each and specific measures. Now, the principles of proportionality and the principles of necessity are key legal principles alongside non-discrimination, legitimacy, and others. But you can summarize very easily what we mean by proportionality and necessity. We mean by you should crack a nut with a nutcracker, you shouldn't crack a nut with a sledgehammer. So you need to adapt the means that you deploy to achieve a given objective. So when you're regulating front of pack nutrition labeling or other you introduce other measures, you really need to ensure that the measure you've adopted is able to achieve the objective, and also that it does not unduly restrict competing rights or interests, such as trade interest. So this requires legal thinking, but of course, this has to be informed by existing evidence, public health evidence, economics evidence, and evidence derived from a broad range of disciplines. So the point is that governments can regulate within the constraints of international trade and investment law to protect public health from the drivers of non-communicable and other diseases and promote better health. And the Youth for Law and Public Health section will reflect on how national, regional, and global regulatory responses can best support rather than hinder each other. But there are good laws and there are bad laws. Bad laws are not cognizant of the risk of legal challenges. Bad laws are not designed in a way that protects health policy from undue interference and conflicts of interest. Bad laws are not aligned with international human rights standards. Bad laws do not rely on evidence. Bad laws are not effectively enforced. And we do not want bad laws, of course, and there are plenty of them around. They are all the more problematic as laws often take time to change. So we need to get it right from the beginning as far as possible. And we would suggest that there should be a paradigm shift. There is an increasing body of literature on the value of rights-based approaches to the prevention of diseases and the promotion of better health. States around the world are bound by international human rights instruments, such as the International Covenant on Economic, Social, and Cultural Rights and the Convention on the Rights of the Child. Both these instruments enshrine the right to the enjoyment of the highest attainable standard of health and related rights. Therefore, not only do governments have a broad margin of discretion to protect the health of their citizens, but they also have a legally binding obligation to do so. In Europe, we should also refer to the European Convention on Human Rights and the EU Charter on Fundamental Rights and Freedoms that requires at Article 35 that the EU ensures a high level of public health protection in the development and implementation of all its policies, including its internal market policy. Now, I'm delighted to see in the audience colleagues who for decades have been leading the way on the importance of human rights to public health. And I would like to pay a special tribute to my dear colleague, Wenke Barth-Heide, and I'm delighted, Wenke, that you've been able to join us. So ultimately, we can use the law and human rights in particular to regulate industry actors effectively, and we can do so by being cognizant of the limits within which states have to operate. And I would like to say that the Youth for Law section is planning a range of activities on strategic litigation and climate change. And again, my wholehearted thanks to David Patterson, who is leading on this strand of work. So our forthcoming events, we have a couple that are now in the diary, but we very much look forward to more suggestions from you all. Firstly, I would like to invite you to a front of pack nutrition labeling conference that Nikhil Gokhani, Oscar Cabrera, and I are organizing. It will be in September, online, and hopefully also in Liverpool. We will reflect on the use of human rights and law to promote better health in the area of climate change, air pollution, and public health. And we will reflect on how the law can be invoked to challenge governments for their failure to do enough to protect health and environment, and also to avoid environmental degradation. And we will also reflect on strategic litigation and how private parties can be challenged for their failure to comply with existing legal norms. And these private parties would include multinational corporations implicated in growing rates of disease around the world. And I'll give you an example. The Alana Foundation in Brazil successfully challenged Bauducco, food industry actor, for its failure to comply with constitutional and consumer legislative provisions and their failure to protect children from the harm resulting from unhealthy food marketing. So all these events require that we reflect on the question of how the tension between international trade and investment law on the one hand and global health and international human rights law on the other can best be addressed. Now, this tension is not insurmountable, but to ensure that it is indeed dealt with effectively and for better health, we will need to engage different disciplines, including public health, political economy, etc., but also work with different sub-disciplines of law, including human rights, public health, international trade and investment, European internal market, consumer protection, environmental law, etc. And this is when we will be able to build greater legal capacity for better health. So I very much hope on behalf of the Youth Law and Public Health section that you're going to be able to join us and support these efforts. And if you have any ideas of what the section could be doing, and if you would like to propose some events, we would be delighted to hear from you. And you will find here the link to our website. I very much hope to meet many of you I haven't yet met, and I look forward to working with you. Thank you.
Thank you. Thank you very much indeed, Amanda. That was very, very helpful, and it's very helpful to have a scholar sharing with us, and that's what highlights the importance of our partnership working and causing strategic partnerships and so on. And we can discuss more about how to join the section and so on in discussion section if colleagues are interested. Thank you very much indeed, Amandine. There are some questions that in the chat room and also in the Q&A sections, as is the culture now with Zoom. Please join in. We'll discuss some of them now and some of them in the discussion section. Thank you very much indeed, Amandine. It's my pleasure now to introduce to you our next speaker, Professor Markus Früchschutt, who is the Jean Monnet Professor and Chair of EU Values and Digitalization for our community in Austria. He's also a member of the steering group for the new section, and it's good to have the diversity of interest expertise. He teaches at the MCI, the Entrepreneurial School, and he's a coordinator around European law. For our colleagues from Africa and Australia and so on, in this initial one, there is a little bit of focus on European colleagues, but quite clearly the lessons learned are somehow universal, particularly, for example, Amandine's presentation and so on. His major areas of research have been EU law, EU health law, EU values. He's actually writing a book at the moment. Apologies, Marcus, for me advertising it. At the moment, he's writing a book on EU laws and values, which is a little bit strange for colleagues in the UK who just left EU, but I'm sure there's a lot to learn about values from his scholarship. And so on. The other very interesting piece of work colleagues may wish to refer to is that he led a major study which was commissioned by the European Parliament on strengthening transparency and integrity via independent ethic bodies. And this is actually of interest across the world around how do you actually provide ethical input into decision making and so on. And his report, which we presented to the European Parliament some months ago, is very illuminating for others in other areas. So it's a great privilege now to hand over now to Professor Marcus Fruscher. Thank you.
Thank you, Farhang. Thank you everyone at the faculty and at UFA, both in front of but also behind the scene for the organization and also for the invitation. I feel very honored to join this session which was very distinguished colleagues. So I want to talk a little bit to you about EU law, common values and public health. A lot of the issues were already mentioned by Larry Gostin and Amandine. As it was also mentioned, this work that I've been doing is part of this Jean Monnet chair, kindly supported by the European Union. Can you see the slide with the bridge?
Yes.
Yeah, okay, great. So the starting point for my work was a lot of examples of the law of the European Union referring to non-legal concepts like ethics, morality and others. And once you look into ethics as a branch of practical philosophy, very often if you reintegrate that knowledge into law, here in EU law more precisely, it's not very clear in the end what that means in terms of a practical outcome. And Larry already referred to the rule of law, and one part is legal certainty. So long story short, when I did this analysis, I in the end argued that at this interface of two different disciplines, you need to take into account values and human rights, which can be seen as a bridge, so to say, between those two disciplines of law and philosophy. Now, if we look into very briefly how the European Union has developed, it has started as a community of economic integration in the field of coal and steel, where the ultimate goal was to safeguard peace between France and Germany, especially. And then only later on, human rights have been added as an additional layer, so not replacing, but additional. Also political integration. And finally, with the Lisbon Treaty, the union has also become a union or a community of values. Now, what are those values of the European Union, which you can find in Article 2 of this EU treaty? Please be aware of the fact that the first sentence refers to the European Union. The second sentence refers to the member states, and also here to a society in the member states. And second issue I want to emphasize with regard to the first sentence, here we have this understanding that those values are pre-existing, because the union can only be founded on those values if they have already been around, so to say, before the Lisbon Treaty. Farhang also referred to Africa. I just yesterday came across a paper discussing human dignity and its relation to some ideas of Ubuntu in Africa. So although I'm presenting you the EU or European perspective, I guess we could identify a lot of those values also elsewhere in the world. So Larry already also referred to the rule of law, which is important in general, but also especially these days, and also other values that you can see here. Now, if we just look into two of those issues, human rights nowadays, we have this Charter of Fundamental Rights of the European Union, where actually a lot of those rights entitle all human beings, not only EU citizens. And Larry Gostin also referred to non-discrimination, which is very important, especially these days in the pandemic. And as I hope you can see from this overview, we have a lot of criteria according to which people should not be discriminated in the European Union. So that's again, talking in Larry's words, I would say one of those examples where there is a very important indirect contribution to the health and public health field. Here talking about equity and non-discrimination based on various grounds. Now, to summarize that, and of course that's a simplified way, there are various ways how the law of the European Union can impact on citizens and companies. To start at the bottom here, we have harmonization of national law via EU directives, so anti-discrimination directives, cross-border healthcare, and a lot of other examples. We also have, and it's very important that here we very often also talk about the economic level, which impacts on health. We also have those economic market freedoms where EU citizens can also rely on this freedom to receive health services elsewhere in the European Union, and where public health is one of those reasons of justification. And now, since the Lisbon Treaty becoming more and more important, also this dimension of human rights, where the one article on healthcare has mainly been seen as a negative right, so against interference, and so far has not contributed a real added value because it refers to national law, and so you would only be entitled to what you already have at national level, and in other words, there is not more on European level. Larry Gostin and colleagues have referred to this evolutionary element of human rights. So human rights represent universal imperatives, but they are not static concepts. And to my knowledge, it was the first time in December last year that the EU's Court of Justice in Luxembourg has adopted a concept that we can find in the case law of the Strasbourg Human Rights Court, which is referring to those human rights documents as a living instrument, which must be interpreted in the light of present day conditions. And therefore, you need to take into account changes in values and ideas, both in terms of society and legislation. And it's in this context that I would like to share another very recent judgment, this time roughly a month ago, from the German Constitutional Court, which has interpreted, obviously, the German Constitution, more precisely the right to life and physical integrity, and from those two rights has stated that this includes, so here we have not a negative but a positive right, the obligation to protect life and health from the dangers now of climate change, which has also been mentioned earlier. And I think what is very remarkable, quote, the state is obliged to do this both for the people living today, so lawyers might think of this right to legal standing, and under objective law also with regard to future generations. So I think that is quite remarkable. And having in mind the statement that human rights are not static concepts, and now also the EU court referring to the Charter as a living instrument, I think that can be seen as a very promising or promising statements. Now I have to be very short on terminology because we have colleagues from different disciplines and there are different understandings. So let me briefly share my understanding of values and principles. So values are more abstract concepts. Basic attitudes of people who stand out to this special firmness, conviction, and so on. And so they're more abstract. They do not have legal consequences and legal addressees, which we actually can find in case of principles. So they are more concrete. They can also be enforced. Amandine already talked about proportionality. So that's a legal principle that you can actually enforce and which can have legal consequences. So as opposed to some of those values. And now looking into health, we can find a very interesting document from 2006 where the EU health ministers have now, besides those general values, but for health have defined specific health values. So universality, access to good quality care, equity, and solidarity. And underneath those values, also operating principles, which are mentioned here. And as Annick has mentioned in 2 of her books, those conclusions, those principles and values can help shape the interpretation of fundamental rights in EU health law. So as you can see in this document, here we have the advantage that we can find more information. What does it mean universality? What does it mean equity? And if you read this understanding, then you can see why, although equity is not mentioned as a value, as a general value, but if that refers to non-discrimination, then we can also see it as part of those general values. And also solidarity, you can see here we have some understanding because it's more specific field in terms of what that means. Underneath those values, we have certain principles, and as you can see also for those principles, we actually in this document do get some insight in terms of what those principles should mean, which sometimes we do not have if we take a very general value like pluralism or tolerance. So there can be even human dignity. There can be a lot of discussions what that should actually mean. So I have argued in some papers how to put that together so here, as you can see on the left-hand side, to have a combination, so kind of following this idea of those health values conclusions, to have more abstract values and more concrete principles, which could be principles, as you know it from this book, in the field of biomedical issues, ethical principles, but it can also be legal principles, proportionality and precaution and others. And the same for the general issues, but here also for the field of health more specifically. Of course, at the bottom, we always have law as the minimum standard. So of course, you cannot discuss whether you have to adhere to law or not. So that should be rather seen as in addition, as a more ambitious approach, so to say. If we just briefly point out one example, solidarity. So here you have a colleague, here you have a definition from 2 colleagues from Austria and Germany. So this enacted commitment to carry costs to assist others with whom you have some similarity. Annick has referred to redistribution and risk pooling in the field of solidarity, and I have seen that in the chat there have already been questions with regard to international solidarity, COVAX initiative, which has been addressed a lot of times recently. So I just want to mention that, not going into details, so we have enough also topics for the discussion. I think it's also worth looking in some statistics. So I guess most of you know those Eurobarometer surveys. And here you can see personal values of Europeans, kind of what we have seen in this Article 2 earlier. And you have solidarity. Now, as a new feature, also respect for the planet. So that has not been questioned earlier. And we also have values representing the EU. And you can see some differences, but on both slides, you can see that solidarity is not ranked top. EU law, common values, and public health. And if you look into public health, that's a very good example of this step-by-step approach in terms of historic development. Because in the 1950s, public health did not prominently figure in those EU treaties. It was mainly a reason of justification. We could find some information on workplace health. We then had a very, and Anik has written a lot about that, this phenomenon that we don't only have formal meetings and the formal sphere, but also informal meetings of health ministers, as we have also seen it with the European Council. And then it's very interesting also if you look into some proposals here of the European Parliament in terms of how the European Union should develop. Very often they have been more ambitious, suggesting social and health policy. And it was done only in the Maastricht Treaty that a distinct sexual health policy was implemented. So a competence, or for US colleagues, we would talk about legal authority or legal power for the European Union in this field. Even before this Maastricht Treaty, we have already seen a lot of topics done at a soft law level. And whenever there was some activity on a hard law level, then this was done based on other more economic competences, or again, authorities in US terminology. It was then again an unofficial proposal of the European Parliament, which already referred to values, that was not adopted by the Amsterdam Treaty. So again, we've seen this common pattern of the EU simply reacting to a crisis, mainly BSE at the time, and adding more competencies, authorities for the EU, at the same time emphasizing that it's the member states who are responsible for the organization and delivery of health services. There were no major changes in the Nice Treaty. The Constitutional Treaty would have been very interesting because it would have added more competencies for the European Union in the field which we are currently discussing very often in terms of the pandemic. But as you know, this treaty did not enter into force. So therefore, the last change with the Lisbon Treaty, there have been some clarification. So overall, and to come to an end, you can see this step-by-step approach of EU law in the field of public health. A proposal which I've not yet mentioned, a lot of people talk about the European Defense Community, which was proposed in 1954, which failed in a similar way as this European Health Community, French proposal, which failed 2 years later. Nowadays, we talk about the European Health Union, and I may again refer to the work of Anik. But interesting to see that there has already been such a kind of a proposal into this direction very early on. As I've argued, there should be a combination of more abstract values, so abstract is not negative, and more concrete legal and ethical principles. And this evolutionary approach that we can see in public health is also true for human rights, where we have now for the first time in December 2020 seen this statement of the EU Court of Justice referring to this EU human rights document as a living instrument, so this evolutionary aspect. I've just pointed out one example, solidarity, and I guess there's a lot of room for discussion later on. And so as I think as time is running short, I want to thank you for your attention, and I'm looking very much forward to the discussion.
Thank you very much, Marcus. That's really very helpful and interesting and education for us as practitioners to know at least somebody knows all these important materials and collaborating in further advancing this particular agenda. We look forward to reading your book on the issue. It's my pleasure now to invite our final speaker, Professor Aniek Rugter, who is Professor of Law at Policy at Amsterdam Law School at the University of Amsterdam. She's actually the founding director of the Law Center for Health and Life, which is a very, very interesting center which she's created at the University of Amsterdam. Also, she's director of a very innovative Amsterdam law practice for experiential education. And as a leading academic of the issue, she's a member of various boards and so on. And for example, she's on the editorial advisory board for the Lancet Regional Health Europe and a lot of other sort of academic work. But I was particularly interested reading her profile, that when she was recently interviewed at her university, they asked her a question: you've achieved a great deal and researched many topics. Are there any dreams left to you to pursue? And I was interested that it was reported in the papers that, yes, I come up with new ideas for research all the time. I prefer to collaborate with others on studies to transcend the boundaries of law as a discipline. One example of this is coming out of ways in which law can contribute to good health as a social determinant, or exploring what we can do today to ensure law is open to innovation, so that we can more effectively integrate consideration for the environment, agriculture, and other aspects that impact health. As a member of the new UFA group, I think her dreams, I think hopefully will soon come true through this new section. So it's a pleasure now to invite Professor Rugter now to share her presentation. Thank you.
Yes, thank you very much, Farhang, and thanks all for being here and inviting me. And I'm very happy to be here at this UFA event and at this first very festive kickoff of our law section under the inspirational chairpersonship of Professor Amandine Gard. So my presentation for you today is Law, Governance, and the Future of Public Health in Europe. And I want to focus in that broad title, under that broad title, a little bit on the future of EU health law. So as we all know, the question of the limited EU legal powers has been a long-standing debacle for the health community mostly. So COVID-19 definitely revealed weaknesses in this respect, in the possibility or the ability of the EU to respond effectively. And so calls have been made for a European Health Union. And under the heading of the European Health Union, the European Commission has proposed strengthening the ECDC, the role of the EMA. Of course, right now there's that discussion about a new HERA facility. And even Angela Merkel on the 21st of April has not ruled out the possibility of a treaty change. So there's a future ahead for the role of the EU in health and a renewed discussion. And so here I want to talk about what is actually going on with the current EU powers in health, and what difference could more EU power, legal power, make procedurally and also substantively. So currently, how does it work with the legal powers in health in the EU? Now, the treaties of the EU, we have the Treaty on the European Union and the Treaty on the Functioning of the EU, two important constitutional treaties, create a system of conferred power. And that means that all the power to make laws remains with the member states. So the member states are in the driving seat unless power is conferred for the EU or to the EU to harmonize national laws. So for instance, in the area of the internal market, Article 114 creates a legal basis for the EU to harmonize laws so that there can be an equal playing field, so that there can be, so the national laws are harmonized so that there can be one market. For instance, in the area of agriculture, products, all kinds of areas where this could have a benefit to all citizens in the EU and to the member states. Now, this has also not only happened in the area of the internal market SEC, it also has happened in agriculture, in fisheries, and in some more social areas such as employment, but also, for instance, we have in education. But in health, there has always been a limited health competence. So the EU is, for the way that the EU power in the treaty is created in the area of health, is that the EU is to mainstream health in all of its policies and activities. I'm sorry, my neighbor is rebuilding their place next door. And so we see this in Article 9 of the Treaty on the Functioning of the EU and Article 168. EU policy, health policy and law can really only come in generally when the EU is doing other stuff. So when the EU is creating an internal market, then it needs to do that with taking into consideration health. And for the rest, the EU is not to create health laws and policies, except in a couple of instances that have come out of all kinds of emergencies. So in the area of the safety of medicines, the EU can harmonize the safety and the regulation of the safety of medicines. When it comes to blood and blood derivatives, of course, we have that is thanks to the BSE crisis, this came into the treaties, and veterinary and plant health and safety, which is, of course, very much also linked to the role of the EU in agriculture. And then there's that the EU can adopt incentive measures when it comes to cross-border threats. But an incentive measure, nobody really knows exactly what that is, but it's definitely not a way of harmonizing laws. So a way of directly regulating what member states, at what level of safety, for instance, member states can regulate a particular market. What is important, though, is that in the area of health, these areas that I just outlined, these harmonization and incentive measures, they can be adopted in accordance with the ordinary legislative procedure. And that means that it involves the Council, which is representing the member states, and that it involves the European Parliament, which represents the citizens. So for the rest, the EU does a lot in the area of health, but it's all very much supporting, coordinating, or in the context of other policies where health needs to be taken into consideration. And this is why people say that the EU has only limited powers in health, because generally in the area of public health, no laws can be made except in those couple of examples, those couple of medicines and plant, etc. And when it comes to the organization of health services in paragraph 7 of the Article 168, definitely the EU is not to create any laws, because that is the area, and we'll see that later on as well, where member states have where a lot of public funding is involved, and so the member states do not want the EU to have too strong a power in that area. So what does the current situation create? Why should we need a treaty change? Because of what is wrong with this situation, actually? It causes, the current legal basis for health causes a disconnect between the national and the EU political processes in health. So at national levels, health departments and the attached know-how of the medical establishment and civil society is involved in health lawmaking. So health lawmaking, it's initiated usually in health departments, etc. And there's a lot of lobby and medical establishment and health establishment surrounding that. At EU level, it's not always clear who's in the driving seat of health policy making. It can be part of an agriculture debate, it can be part of an internal market debate, or enterprise. For the longest time, the area of medicines was regulated in enterprise, and then it came to health, etc. And so that invites different national representations. It also explains, and this situation also explains a little bit the defensive nature of Article 168, and particularly paragraphs 5 and 7. So every time the EU was doing something in health in other areas, Article 168 was actually used to reinforce this prohibition of harmonization, and it gave a place where the resistance against more EU power in the field of health could take place through the health representations of the member states whenever a new treaty was being discussed. And with good reason, because there are very important differences, of course, across member states on the quality of care, the nature of the organization of healthcare, but also it involves a large area of redistribution, tax contribution. Its political salience of health for national politicians is, of course, without question. So there are good reasons why member states, and particularly also within the health community, have some reservations around a stronger role of the EU. Yet the problem is that this limited legal power has actually not stopped EU law inroads in health. And some of the stuff that Amandine was also talking about clearly evidences that. It only has mostly disempowered, paradoxically, the role of member states' health representation and the connected health communities to be involved in EU health lawmaking. So what procedural difference could an expansion, so say that instead of having a coordinating kind of soft legal power in health, what would an actual shared EU health competence, what difference would that make for the procedure? So for the procedure, if there was a broader shared legal competence in health, the ordinary legislative procedure would have to be used for making health law. And that would have to be based on Article 294 of the Treaty on the Functioning of the EU, which engages the member states, which engages the health departments in the Council of the European Union. It engages the national and the European parliaments, and it engages the connected expertise of the health community. Now, in the softer governance methods that are now still very much used, the stakeholder engagement is less formalized, particularly that of the national member states, where actually the core of the expertise of the health and the public health expertise lies. And what also happens a lot is, of course, using the competences, the legal basis in other fields. And also there, other policy expertise is engaged. And so that kind of puts the health community more to the side. So I do want to put out a disclaimer here. There is no legal rule in the treaties that representation follows competence. So it's not a given that if there is more health competence, that that will never be used by any of the other representation, that it will never be that then there's any agricultural policy created that might be based on an actual health competence. But there is a political reality that would presume that that increasing the competence, the legal power of the EU in health would also increase the representation of the national national ministries and the attached health expertise. Because currently, for instance, there is no separate council configuration of health. So health is part of the EBSCO Council, which also includes employment, social affairs, etc. Now, if I was the member state and I would increase the competence of the EU in health, I would also make sure that a better national representation would be ensured, and that can be done by the European Council on the basis of Article 16. And at the same time, it would also be it is to be expected then the use of the Commission, the right to initiate legislation, would more likely come from the Directorate General of Health, rather than, I don't know if we all probably remember, when the Services Directive was first initiated, it included health, which caused a lot of pushback. And that proposal was made by DG Markt, not involving at all the experts in DG Health. But there's also, and probably that's more important, or it is connected, a substantial difference that an increase of EU power would have. And the substantial difference is that it would create a better potential for an actual political discussion on the need for an EU intervention. Because on the basis of, and it seems now that the use of a conferred legal power is limited by the principle of subsidiarity in Article 5 of TEU. And so the principle of subsidiarity requires that a political choice is made on whether the union action will actually achieve an outcome which the member states acting alone could not achieve. And so this really requires, so even if the EU has the power, that doesn't mean that the EU can always use that power to create laws. First, it needs to prove that that legislation would bring a result that the member states alone cannot achieve. So it would need to discuss what is the objective of the conferred power. In this case, it would be health. It would be to improve health. And does that objective align with the objective of the law that is under discussion? And that objective is again health. It's not another objective. It's not, we're not using any power in the area of the internal market. So health doesn't come second to other objectives in this political discussion that we can now have if there was more EU power. So the assessment that then would substantively be made in this new situation, on the whole, would be more likely be whether this legislation is useful for reasons of health. And that is really different from the discussion when health is ancillary to other policy objectives. So that subsidiarity discussion in view of the health objective would create more room for a more health value-based discussion on some of the values that also Marcus has been talking about. And that can often mean that from a health perspective, less EU might be better for health. Respecting national differences might be better for health. And so this creates this interesting paradox that more power, more legal power in the field of health might actually mean less EU health law. Thank you very much.
Thank you very much indeed, Annika. That was a very, very good question to actually to end on. Dr. Gurkhani is going to help us to draw up some of the questions and so on. But I'd now like to invite Professor Martin McKee, who is known to many of us, to reflect and share some of his reflections. For those of you from other continents who may not be aware of Professor Martin McKee, is that he's Professor of European Public Health at London School of Hygiene and Tropical Medicine. He's the founding director of European Centre for Health of Societies in Transition, which is a WHO collaborating center he founded. He's research director of the European Observatory on Health Systems and Policies, and many, many other initiatives. But one of the important things, which I think we'll hear more about, is that he's currently chairing a scientific advisory group of the Pan-European Commission on Health and Sustainable Development. And this is a very important piece of work, which I think can be shared, and it's quite important in that respect. He's a widely published researcher. He's published 1,200 over 1,280 papers, including 46 books, among which are a number of books actually on law, policy, and public health law. And he's one of the most cited public health researchers in the world. I think he'd be embarrassed by me citing this, but he was cited as the top 1% most cited researchers in the world, and was awarded the Dobedin International Award for his work. So it's great that he's had a long-standing interest in public health law. He was a former president of the Public Health Association, and so he's been a great supporter of this new section, and we're delighted that he can collaborate with us at this launch event. Martin, over to you. Thank you.
Oh, Farang, how can I possibly follow that? But also, I'm not sure what I can say to add to what have been some amazing presentations which have set out the detail. So, what I might do is maybe move aside a little bit from reflecting, because you did actually talk about the Pan-European Commission, and I think that's an interesting way in which we're looking forward. That has come out of the COVID pandemic. And actually, law has played a really important part, or could have played a greater part in the pandemic, because obviously, taking the most obvious thing, many of the countermeasures, many of the non-pharmacological interventions and so on have required a legal basis for governments to do things. And there's been a question as to what legislative process they've used, how consultative they've been, how law has been made, and all of these things. I often quote the words attributed to, even if he never said it, but attributed to Bismarck: two things should never be made in public, laws and sausages. But there are, there's certainly been issues around the transparency of the legislative process in all of this. But law is a very clearly important tool in the public health armamentarium as we go forward. And it's not just about the enforcement, the development of rules and regulations and so on, which have been essential, as they always have been in public health law, going back to the 19th century, or actually going back to the Code of Hammurabi, going back for millennia. But they've clearly been important in that area. But I think that there are other areas that maybe we haven't touched on so much, which is the extent to which any crisis creates the conditions for opportunistic behavior, where the law has a role to play. And here I'm thinking of organized crime, criminal activities. We are speaking at a time that our colleagues in Ireland are trying to sort out the effect of a massive cyber attack, which is a ransom attack, which is essentially has paralyzed the Irish health system. And where we have seen a huge amount of criminal activity in terms of procurement. We've had, we can call it cronyism. Some of it probably is illegal, but obviously that in due course will be sub judice, and we need to find out what's happened. But we've seen corruption, we've seen a whole series of other things. So I think that that plus, and I don't want to repeat what everybody has said, because they've done so very comprehensively in terms of the many ways in which public health, in which law can be used, in trade and in safety and all sorts of other ways. But I think that maybe one of the things that's worth stepping back and saying is, where is the interface of law in the pandemic and going forward, and what lessons can we learn from that? Now, I wasn't planning on talking very much, Farang, because I understood that it would be a panel discussion. So I might just stop at that point and then let us get into the discussion. Is that reasonable?
That's excellent. Thank you very much, Martin. It's very helpful. So I would be grateful if the other panel members could now switch on their microphone. Hi. So Nihil, was there sort of a question stood out for us? We also have Monica, who belongs to the UFA. She's the coordinator, the UFA Young Professionals in UFA, and I thought it was good to also have her part of the discussion, because we need to look at the future as professionals. So Nihil, would you like to now sort of kick us off with a question? Or Amandine, do you want to sort of, you've sort of been monitoring the chat and so on. There have been a number of very, very important questions, and some members of the panel have already began to answer them. So you really have the power now, Nihal. You could start us with a conversation, which we can then take forward.
I think one question particularly stuck out with me, and that is, what added value is there, I'm paraphrasing, but what added value is there of having lawyers involved? Because many public health professionals have engaged with law and they have learned it, and they've tried working with law. So the question is, what additional value is there of having lawyers involved in these discussions and as part of these projects?
Okay, this is the going to the den, isn't it? This is Dragon's Den. So Amandine, do you want to kick us off? Or?
Well, hopefully by now you know we're quite a nice bunch, so that can demystify certain fears that people have about lawyers. If the public health community does not engage with lawyers, and if lawyers do not make themselves available to engage effectively with the public health community, then we do so at our own perils. Because at least I work on the regulation of the food, the tobacco, and the alcohol industries, and these industries work with lawyers, and plenty of them. And they work with lawyers who are expert in all these subdisciplines of law I was identifying as potentially relevant to the problem, and we will work with them in every single jurisdiction in which they operate. Because what we didn't have time to cover is that we're presenting some values and principles that are important, but the way these values and principles will become relevant in a given jurisdiction can vary. So I think the reason to engage with, why we need to engage with lawyers is very practical. If you don't, you run the risk of not framing your public health policies in light with these legal principles, and you could face some judicial review action. That could lead to the annulment of a measure or a very delayed implementation, and therefore you could be back to square one, and this is very expensive because regrettably lawyers who don't work for free as we do with the public health community are massively expensive. So you want to avoid this type of situation very practically.
Martin, did you have a?
Yeah, well, I do work with quite a lot of lawyers, Anik, particularly on this call, and I think, speaking as a physician, I think you're absolutely invaluable, and for a number of reasons. First of all, for those of us who've actually tried to read through legislation, it's actually incredibly complicated, and it often means you have to refer back to a previous law and so on. But leaving that aside, it's the interpretation. Because words have meanings, and the meanings are not always entirely clear. And often those meanings have not been set out in primary legislation, but they have been developed in case law. So proportionality is a key issue in all of this. So for proportionality, you talk to a European lawyer, and you immediately think of that very nice cassis, creme de cassis, the case of Cassis de Dijon. And so that's where you get your interpretations from, and you do need lawyers to help you with that. You know, what do these words mean in a particular set of circumstances? And also because so much, and particularly in common law, well, in the Anglo-Saxon system, but everywhere to some extent, the importance of precedent. Those of you who are working in public health who write, and therefore, if you're writing, you may be criticizing people. Then you need to understand what the limits are as to their ability to get back at you, in which I would remind you of the case of Derbyshire County Council versus the Sunday Times, in which in England a public body cannot sue in libel. So that's quite useful. You can write anything you want about public authorities. And similarly, members of parliament are limited as to what they can respond to under the Bill of Rights and so on. So, I think it is important for people in public health to know something about the law, but I think you also have to depend on the proper lawyers who actually spend their time going through all of this, because they have a level of expertise that no matter how hard you try, you will never actually aspire to. And that's where I look to people like Anik and Tammy Hervey and others for the invaluable help that I get.
Anik, did you want to add?
Yeah, I want to also highlight sort of the other direction. I think it's very important for lawyers to work with people in the field of in public health, because there's so many laws that are created where we don't know the actual impact on the ground, and so there is a two-way. It is a two-way street, really. Law should really be made in view of what it could actually impact, what kind of impact it could actually have on the ground. And for that, we need to work with the public health community so that we can sort of define what the law, how the law should look, but that we also do that in light of actual empirical evidence on what happens on the ground with those types of laws, and also try and change them if they have, for instance, the opposite effect of what you're trying to achieve. And at the same time, of course, yes, also the public health community should work with lawyers, not only because sometimes law can impede on public health, and it's nice to have lawyers to help you understand the law, but also because there's legal limitations to all of our efforts to be healthy. And so there's legal limitations to governments, to public authorities on what they can do vis-a-vis the population, or vis-a-vis individuals within the population, because there's legal safeguards like fundamental rights, etc., that also need to be taken into consideration. So it's a two-way street, and that's why I think this event and also this section is so important.
Marcus, did you want to briefly add something?
I just want to add that as a lawyer, you can not really discuss certain topics without the experts in the relevant field, and here it would be public health. So you really need this interdisciplinary approach. And for instance, I've learned a lot from my students coming from non-legal disciplines, because that's how you can create added value. And what was mentioned before in terms of enforcement, I agreed, and as Martin has also mentioned, very often you have imbalances, asymmetric information, but also asymmetric power. And so I just briefly want to highlight one initiative by another colleague, Alberto Alemanno, the Good Lobby and the Good Lobby Profs. So experts providing their expertise. Now I'm simplifying to kind of, again, establish this balance, which does not exist at the moment.
Thank you very much, Marcus. I think public health people, if they need statistical advice, they go to a statistician, and that partnership is essential with work. But we rarely actually understand the need for ethical, legal input and collaboration around that, and strategic partnerships are critical. We have lots of other questions, Nihila. I know, would you like to now share with us another one which we can now consider?
Absolutely, thank you. Yes, so Bill Jeffrey asks a question on the power of large governments, particularly large OECD governments and large corporations, and the regulatory chill that they have, and then when they're challenging laws. I mean, the example he gives is the smallest global Fortune 500 food, beverage, and tobacco company has sales of $25 billion, which is greater than the GDP of half of national governments. So the question is, to what extent and how can we tackle the regulatory chill that these large companies and these large companies and countries have on the regulatory development process and the regulatory enforcement process?
Very important. I know a number of the panel members have got expertise around this one, so I don't know who would like to kick us off. The issue of large government is not how the Americans use the term here. You're talking about small countries, I think, right?
So big countries like European countries, the US.
Because the words large and small government in American terminology. Martin, yes, please.
Well, there's two things here. One is the extent to which there is a government that is willing to stand up to the corporations. And here, the example I would pick out would be Uruguay under its former president. And the difficulty is that when Philip Morris or BAT or one of those went for Uruguay under on the plain packaging legislation, then essentially the Uruguayan government did not have the resources to fight the legal challenge against that. It was just outweighed, but Michael Bloomberg weighed in and provided support for them to do that. And of course they won. Thing is that actually in the courts, and we published a systematic review some years ago, when the tobacco industry has challenged governments, usually on constitutional law, including the devolution bill in the UK, they have either invariably lost, or when they haven't lost, the courts have told the legislatures how they can revise the law so they will win the second time round. As happened with Germany and one aspect of tobacco policy, I've forgotten precisely which one. There's that, but I think actually the much greater problem is simply corruption, the revolving door, and that's where politicians are bought. You know, we all know about the challenges of, you know, the amount of money that certain tobacco companies spend taking people to rugby matches and the Chelsea Flower Show in this country. And I think that's a greater issue. But, you know, there is a threat, and I look to the lawyers here for comment on this, but I think sometimes we're a bit too reticent, and we're too, you know, we're worried that we'll breach some law. Well, first of all, governments can make laws. Now, of course, obviously, there may be conditions in trade agreements. We are sitting, Farang, you and I are sitting in a country today which is clearly putting the interests of other people above the interests of this country as it looks for trade agreements all over the world. And, you know, we have a contemporary example in agriculture with Australia at the minute. But generally, countries actually do look after their own self-interest. As I say, we may be an exception. And if they do that, they can usually legislate. And the thing is then that they need to be, you know, there is clearly an issue in international trade agreements, which of course are not technically law. Well, are they law? Somebody will correct me. But often they're settled not in courts. And that's why, you know, corporations don't want them to be in courts, because if they're in courts, they're open, they're subject to precedent, they're subject to the interpretation of, you know, that's why that was one of the reasons why the Transatlantic Trade and Investment Partnership broke down, because the EU wanted a court, a quasi-judicial mechanism, whereas the US didn't. And the UK isn't very positive about those either at the minute. So I think countries can stand up, but they need to be a bit more courageous, and sometimes they can get support from others. But, you know, I'm not diminishing the extent of the problem.
Thank you. Leadership is what comes to mind. Marcus.
I want to confirm was what Martin mentioned. So this study that you had mentioned that I did for the European Parliament, and I've shared the link, that's precisely to strengthen ethics at European level. And despite of having single institutions and members of parliament judging on their peers, and a very ineffective situation as it has been proven by statistics. So to strengthen that, and by looking at examples in the EU, France, but also outside Canada and also Ireland and the UK, I think that's not hardcore public health law, but I think it's very important to strengthen that, as Martin mentioned, that corruption is very detrimental in this field.
Thank you very much indeed. Thank you. I don't see any other hands. There's a question from the ASFA president, John Middleton. He's asking a very practical question. What are the practical international trade law interventions that are necessary to make a vaccine patent waiver happen? This is actually a piece of work I know that public health colleagues in the States here are thinking about, and John is involved in that. So what are the practical international trade law interventions? What's your expert advice to make this happen around vaccine patent waivers, to make it happen? Do we want to make it happen?
Well, I'm on record as saying we should do it, but I've spoken enough. I mean, as far as I'm aware.
Amanda, is there anything we can do? We should do?
I can't take this question because that's not an area of expertise I have, patent law at all. I suspect there will be some TRIPS agreement implications,
yes.
But
I think it'd be useful perhaps for the section to look at this, because I know there are a number of policymakers who in terms of our global pandemic, we need to get experts such as from the O'Neill Institute and so on. Thank you for your question.
I don't think there's any problem under TRIPS, actually.
No, I mean, this can be done. This is a matter of politics. This is not a matter of law.
I think
there's no barrier that I'm aware of under TRIPS.
It can be done. Of course, there needs to be agreement about it.
Yeah.
And it probably involve a number of pre-existing agreements, changing them. So there's a level of complexity of multi-layeredness that is not interesting for this meeting, because you have to do it on paper, and then it becomes a nice little legal puzzle. But the problem is political.
Yeah.
I think I will give myself a microphone as president of a section. We are very happy, as we said, to collaborate on things, ideas, and so on. But the 6 or 7 of us who are on the steering committee cannot be expected to deal with everything under the sun. So you'll have to bear with us, and you'll have to suggest ideas as to how the section can promote working groups that would like to work on these specific issues. So it's certainly not to dampen enthusiasm, but we're unlike, I mean, we're not going to act as the legal office, where as soon as someone has a question, the question comes to us, because this is just not possible. So we welcome questions, but expect us to perhaps say sometimes we do not know, and we'll try to put people in touch and can act as a sort of network, playing various connections and using the membership of the section to assist and help find answers to these questions. But you realistically, we may not be able to answer everything and within a very short time frame. So please bear with us, but join us to help us develop this knowledge.
That's very helpful. I think since the workshop has begun, we've got about 460 members, and I think that the steering group doesn't have to do the work. I think the membership, as in terms of advocacy and work, can do that. There are some direct questions to you, Martin, in the Q&A section. With some colleagues who you're aware about. Nihil, I just wonder whether you've now picked up another question which we can discuss.
Yeah. So Andrew McWilliams asks a very interesting question on international human rights law. In the context of the UN Convention on the Rights of Persons with Disabilities, but the question is, it has broader implications, so maybe we can think about it a bit more broadly. He points out that some provisions in international human rights law haven't been implemented at a national level. And what does that mean for international human rights law? Does that mean that these international instruments are completely ineffective?
Do you want to take that, Amandine?
Yeah, Amandine, please.
Do you want to take it, or I can take it too?
That's the point we were making earlier, is that laws need to be implemented to be effective. Very often there have been discussions around the effectiveness of trade and investment law, because you have clear enforcement mechanisms, and the WTO dispute settlement body, as well as international arbitration tribunals. It's more difficult because the international human rights system does not have these dispute settlement bodies in the same way. So what we can envisage is use accountability mechanisms that are available under international human rights law, and use the reporting mechanisms. States have to report on their compliance with different conventions on a regular basis, and it is possible for NGOs to submit reports to explain whether or not states have complied with their obligations, and if not, why not. And it is a way to get evidence of lack of compliance that can have some impact, but it's not the same as, of course, having a dispute where you have an adjudication body that can rule on the dispute.
Can I add to this, besides the reporting of states, I always think that the best way to make international agreements have an effect is because they have to come on the ground somewhere. Otherwise, it's an abstraction. Many people look at them as an abstraction. But the best way to use them is in the national courts. So if you have a good case and you bring litigation, be sure to ask the lawyers to include references to these international instruments. That is how they become living law. right? By having national judges have to think about whatever is going on the ground, whatever practice is happening in light of these international agreements. And sometimes even when a treaty is not even ratified, it can still serve as sort of inspiring the case to see what's going on the ground. Lots of other countries have agreed to this agreement. Why haven't we ratified it? Look how this case is the perfect example of why we should have ratified that treaty, right? So bringing it on the ground in the national court is the best way of making international human rights law effective for the people that it's actually there for.
Although there is an interesting, I think, because we've got people listening from different countries, and I defer to the lawyers here, but to some extent it depends whether you've got a dualist or a monist system. Like in the Netherlands, international treaties have direct effect, whereas in the UK they don't. And therefore there are differences in what you can do. And you're, I think, in a much more fortunate position. And we in the UK have, we have a government at the minute which is seeking to limit judicial review, which is trying to constrain the scope of the Human Rights Act, but also our application of the European Convention on Human Rights, and so on. And I think for those of us in public health in the UK, frankly, we need to waken up to what this government is doing at the minute, because there is a legislative attack on many of these issues. Talking about activist lawyers, we have a Home Secretary whose behavior is frankly an international disgrace in terms of human rights. And here I just, as we often do, apologize to all of those EU citizens who are now coming to our borders and being detained. And so I think people listening in the UK, we really need to start waking up and engaging with just what is happening here.
Thank you very much indeed. Of course, when you refer to UK, there are differences in Scotland, and in terms of which is quite important in the discussion.
Scotland doesn't control its own immigration policy. What was very reassuring was that 2 people were being deported or were being arrested by the immigration authority recently, and people in Glasgow gathered round the van and actually they were freed. And the Scottish government has been very clear that it opposes the immigration policy, the hostile environment being created in Westminster. But that's a very good point, Farhang.
Thank you. Nihil, just one or two more, please. You could pose 2 at the same time, perhaps, so that because time is actually running out.
There's a broad question which might be a good way.
Yes, then I will wrap up. Thank you very much indeed. Thank you.
So it relates to the COVID-19 pandemic. So it's a broad question from Mark Davies on asking the panel to expand on what they believe the key learning points are from an ethical and legal perspective. What the key learning points of COVID-19. And the second part of the question is, to what extent can the lessons that we've learned be applied to other public health concerns, including the climate emergency that we're facing?
Wow, answers back at the envelope. So who would like to sort of say a couple of sentences about this one? While the panel are thinking, there are 2 big resources colleagues may wish to refer to. One is the US, Scott Burris and his friends have got a playbook on COVID, generating legal learnings. I will put that on the UFO website. The other one, UCL, have got an Inksaltopedia of country profiles and the legal frameworks, which provide comparative study and also some offices for learning. And perhaps we should discuss this in the future with the respective researchers. So there are researchers who are gathering legal learnings. I just want to, whether the panel would like to make some comments around this. We are in the, Amandine, Anik, thank you.
Yeah, I think for the ethical perspective, I'll leave to Marcus, but legally, I think one of the most important things that we need to, and it's obvious, but we need to learn from the past, right? I mean, we've had some outbreaks already in the beginning of the 2000s. There were opportunities there, at least when we look at the EU, to create stronger coordinating position for the EU, to create stronger mechanisms for the joint procurement of medicines, for actually thinking ahead about distribution issues, for the knowledge you need to have to put that into practice when something like this happens. And so, and at the time, those things were actually proposed. So at the time of swine flu, for instance, a lot of those things were proposed, but there was no political will. And so I think now we need to learn our lessons and actually create a better legal position to be able to be prepared for those types of situations. The second thing I think is that we should be so happy that we have laws in these cases, because the legal limits, the constitutional limits, the types of discussions that have been had in all of the different countries in the constitutional, so in the constitutional courts and in the courts, about how far can the government go in this situation. And there's that little, basically it was just the laws that was stopping also, so just to stop and think sometimes a little bit before you rush into things and before you interfere with legal safeguards, throwing the baby away with the bathwater, because in the end, what is left after a big emergency if there's no rule of law, if there's no society left, if there's no protection of private and individual rights? So I think that was also a major lesson. And none of it was perfect at all. None of it was perfect at all. But I do think some of those discussions have been very important in any case. And it's been, I was happy that there were cases and instances where there was that the law created the platform for actually to stop and think.
Martin and then Marcus.
Well, just to add to your resources, the European Observatory's COVID Response Monitor, where we put out a lot of information on what people are doing. And this question will be answered at length in the Pan-European Commission report. The background material to which Victoria Kirby and Maeve Ann Skulvik, among others, have contributed is currently at about 50,000 words, so lots in there. But I just want to give a shout out to Joe Maugham, who's a lawyer in the UK, who runs the Good Law Project, who has taken the British government to judicial review and has exposed malfeasance and malpractice on an epic scale. And I think really well done to Joe and his team.
Marcus, briefly, thank you.
Very briefly, I want to refer to, I hope I pronounce him correctly, Moylan mentioned humanitarian solidarity, as I also refer to solidarity. So the responsibility to protect those persons whose existence is threatened by circumstances beyond their control. And I think we all agree that the pandemic has highlighted those issues. And second issue, I think, which is very important, we always talk about human rights. Honora O'Neill has advocated for not only human rights, but also human obligations. So we have an obligation as a society to work together and not just to demand rights, kind of like consumers. So two very brief comments.
Amandine, please.
Yeah, to follow up without repeating, I think when there is a massive pandemic, we've seen that some economic actors have been very opportunistic to sort of present themselves as the savior of society and the beacons of public health, with tobacco industry distributing masks around the world. Just to give one example, I think the public health community has to be opportunistic too. And if you see that COVID, Boris Johnson, for all his flaws, end up getting COVID, and a few months later, because he was told his unhealthy diet and lack of physical exercise had contributed to his response to COVID, we have an obesity prevention strategy. I'm just saying, in a word, that we can be opportunistic to creating opportunities from what is a very sad and difficult situation, and the same is true of climate change.
Thank you very much indeed, colleagues. We have 30 seconds, I think, to go. So thank you very much indeed on behalf of Amandine and all the speakers, to the participants. This is beginning of a new section. Many of you have asked how to join the section, where there's a recording. There will be a recording of this available on the UK Faculty of Public Health website and on the UFA YouTube site. And there are details how to join the section. Number of people have as Amandine highlighted, it won't be the steering committee doing the work, but all the members, and look forward to pushing forward this agenda and unleashing the power of law for better health for all, because I think we've learned a lot what to do and what not to do with the law during the pandemic. Now we need to apply that to reaching the Sustainable Development Goals and other shared goals. Thank you very much indeed for excellent set of speakers, for Monica Brandsack from the UFA Young Professionals group who has supported this, and we were doing some sessions around law with them, and the UFA week, I think, concludes tomorrow with leaving no one behind, and certainly the strategic partnerships which will develop with public health and law, we hope no one will be left behind in that particular agenda. So thank you very much indeed, and good night and good morning and good afternoon, or whatever I'm supposed to say to close this one. Thank you very much for your participation and look forward to working with you. Bye then.
Thank you. Bye-bye.